10 common ovarian cancer signs that you should never ignore. Welcome back to the channel, ladies. Today we're diving into a topic that's incredibly important but often overlooked: ovarian cancer. This illness has a sneaky way of hiding behind vague symptoms that can easily be mistaken for minor, everyday issues. But knowing what to look out for can make all the difference between catching it early or too late. In this guide, we want to make you aware of 10 potential signs your body might be sending if something's not right with your ovaries. These signs are frequently underestimated or confused with minor ailments, but learning how to read them could truly save lives. Take a moment to read carefully. You might be helping yourself or someone you love. 1. Abdominal bloating and constant feeling of fullness. Have you ever felt bloated, like you've eaten too much, even after a light meal? If that sensation keeps coming back, it might not just be a digestion issue. The buildup of fluid in the abdomen, a condition known as acids, is often one of the first signs of a growing tumor in the ovarian area. This fluid, produced in response to the cancer, can cause the belly to appear tight and visibly swollen. It's easy to blame this on water retention, an irregular period, or a poor diet. But if the bloating doesn't go away, even when you're eating healthy or drinking more water, it's time to talk to a doctor. Persistent bloating, especially when paired with a heavy feeling in the lower abdomen, should never be ignored. 2nd, pain in the lower abdomen and pelvic area. Unexplained pelvic pain is another red flag that deserves attention. It can show up as constant discomfort or sharp, intermittent cramps that don't seem tied to your menstrual cycle. The intensity can vary, but the key is that it doesn't go away. As the tumor develops, it may start pressing on nearby nerves and organs, causing discomfort in your lower back or inner thighs as well. This kind of pain is often mistaken for digestive or urinary issues, which makes it easy to overlook. But if it's a new, persistent pain, don't brush it off. 3. Early satiety and loss of appetite. One of the subtler but more telling changes can be how your eating habits shift. If you notice you're losing your appetite without explanation, or you feel full after just a few bites even when you were hungry, it's worth looking into. This can happen because the growing tumor puts pressure on the stomach and intestines, limiting their ability to expand. That mechanical pressure disrupts normal digestion and causes early fullness. Over time, this can make you develop a negative association with eating. Some people start skipping meals or eating less because they're afraid of the discomfort afterward. Others chalk it up to stress, summer heat, work pressure, or changes in diet. For example, a woman might begin leaving half her meal uneaten, even though she started off feeling hungry. She might feel overwhelmed at the idea of eating a second course after just a light appetizer. Often, those around her don't even notice anything's wrong. It looks like a conscious choice or healthy habit. But if this pattern continues and is paired with unintended weight loss or general fatigue, it's time to take it seriously. Your body might be trying to tell you something important. No unexplained change in your eating habits should be ignored, especially when it disrupts your routine and affects your daily well-being. 4. Increased urgency and frequency of urination. Are you finding yourself rushing to the bathroom more often than usual? Waking up in the middle of the night to pee when that never used to happen? It might not just be age or too much water before bed. When ovarian tumors grow, they can press on the bladder, decreasing its capacity and causing a constant feeling of urgency. Even small amounts of urine can make you feel like you need to go. Some women may also experience trouble starting to urinate, weak flow, or even small leaks during the day. You might notice yourself holding it during meetings, drives, or errands, which increases stress and disrupts your day-to-day life. If this new bathroom habit isn't linked to urinary infections or any obvious reason, and it comes alongside other symptoms like bloating, pelvic pain, fatigue, or digestive changes, it shouldn't be dismissed. It's common to attribute these changes to age or hormones, but if they're new, persistent, and interfering with your life, you need to talk to a doctor. Catching problems early can dramatically improve outcomes. 5. Sudden and unexplained weight loss. Losing weight without trying might seem like a blessing to some, but if there's no logical explanation, it could signal something serious. As tumors grow, they can affect metabolism and suppress appetite, making your body burn more energy than usual. This kind of weight loss often comes with muscle wasting, fatigue, and a general sense of weakness. If your clothes are getting loose suddenly, or the scale is dropping and you haven't changed your lifestyle, it's time to bring it up with a healthcare professional. Many people tend to dismiss this symptom at first, especially if they've always wanted to lose a few pounds. For instance, a woman might think she's just more active than usual or eating a bit lighter. But unexplained weight loss, especially when paired with other signs like bloating or pain, shouldn't be taken lightly. 6. Chronic fatigue despite rest. We're not talking about normal tiredness after a long day. This is a deep, persistent exhaustion that doesn't go away even with sleep. You might wake up still feeling drained, and tasks that once felt easy now require real effort. Ovarian cancer can lead to anemia, a drop in red blood cells, which limits how much oxygen your body gets. That lack of oxygen contributes to the feeling that your energy is constantly being drained. It's like your body is in a constant fight without you realizing it. If you're feeling run down day after day and it doesn't improve with rest, pay attention. Your body is telling you it needs help. 7. Pain in the lower back. Ongoing pain in your lower back that doesn't seem to have a clear cause should raise a red flag. If you haven't strained a muscle or done any unusual lifting, yet your back keeps hurting, it's worth investigating. Ovarian tumors can press on nearby nerves, triggering pain that radiates to the hips or down the legs. Unlike typical muscle aches, this type of pain doesn't respond to rest, massages, or over-the-counter medications. If it sticks around, don't ignore it. 8. Changes in bowel habits. The digestive system is highly sensitive to changes happening elsewhere in the body. If you've noticed sudden shifts in your bowel habits, alternating between constipation and diarrhea, or a constant feeling of incomplete evacuation, it could be due to a physical obstruction in the pelvic area. Some women report cramps or bloating after meals, or stools that look different in texture, shape, or frequency. These symptoms might easily be confused with irritable bowel syndrome, but the difference is that they don't go away. A growing tumor can interfere with the intestine's normal movement, changing how waste is processed and eliminated. Persistent changes in bowel patterns that don't improve with diet or basic self-care should be discussed with your doctor, especially when paired with other pelvic symptoms. Listening to these subtle signs can be key to early diagnosis. 9. Irregular menstrual cycles or unusual bleeding. If you're still menstruating and notice that your periods have become heavier, lighter, more painful, or more irregular, pay attention. Ovarian tumors can disrupt hormonal balance and interfere with your cycle in unexpected ways. Some women even experience spotting between periods or an abrupt stop to their cycle. If these changes are new and can't be explained by lifestyle factors like stress or new medication, it's time to get checked out. 10th, pain or discomfort during sexual intercourse. Intimacy should be a pleasurable, comforting experience, but when it turns painful or uncomfortable, it's important to find out why. Deep pelvic pain during sex can be caused by tumors pressing on the uterus, bladder, or vaginal walls, which alters the natural movement and sensation. The discomfort may begin right away or only after deeper movements. Some women describe it as a sharp pressure or deep ache that lingers even after intercourse or occurs during urination. It may worsen in specific positions, making sex feel frustrating or anxiety-inducing. Though it's often chalked up to dryness, menopause, or minor infections, persistent pain that doesn't go away with typical treatments should be investigated. Don't feel embarrassed. Your intimate health matters just as much as anything else. Speaking to your doctor could lead to relief and possibly even a life-saving diagnosis. Conclusion: we've gone over 10 warning signs that could point to ovarian cancer, and ignoring them could delay vital treatment. Ovarian cancer is sneaky, but not unbeatable. Awareness is the first step to prevention and healing. If you've noticed strange changes in your body that don't seem to have a clear cause, don't minimize them. Book a checkup, even just for peace of mind. Share this information with the women in your life. One conversation could make a big difference. And if you'd like more wellness tips and health info, be sure to subscribe to our channel and turn on notifications. Take care of yourself. We'll see you next time. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.